I'm Hilary Moulsdale. I'm an exercise manager in emergency preparedness and response. I'm based at Porton Down, the Emergency Response Department for Public Health England. I design and develop exercises for the health organisations and their partners, for example, local authorities, the emergency services, including ambulance, police and fire. And we run training exercises to test their preparedness for, in the event of any emergency, including chemical, biological and radiological events. I work in a team of 14 people. We have a couple of administrators that support the whole team. We also have 4 or 5 exercise coordinators that help with a lot of the logistics of running an exercise. And then we have the exercise managers who design and develop and plan the exercises to be run. The exercises that we plan, design and develop can either be tabletop discussion exercises or workshop-based exercises to test specific parts of people's emergency plans, or they can be large field exercises when we do have actors playing casualties. They're our most exciting type of exercise, but they are the most expensive, so we most often have to revert back to our desktops. We also run command post exercises when we're testing a number of instant control centres and their interactions between each other during an emergency. You have to be a very good communicator. The report writing skills have to be honed to a fine art. We have to deliver our reports after each exercise within a couple of weeks after the exercise has finished. We have to be very well organised. We have to be people so that we don't alienate our planning teams, because what we ask of them is actually quite a lot beyond their own job. It's best to have a degree to build your career on. For example, I've got a degree in biological sciences from the University of Warwick, but we've also got emergency planners within our team, and there's even an events manager as well who's moved into emergency preparedness. Our role is very varied. We probably wouldn't really have a typical week, but for example, this week I would have spent Monday in the office in which we had a team meeting. In the afternoon, I went and talked to a medical director of the ambulance service, who is also an expert on Ebola, because I'm just currently drafting an off-the-shelf exercise for any importation of Ebola that we might see into this country. The following day, I was at the Warwick Public Health England conference talking about 3 polio exercises that we ran for the World Health Organization, one in the UK, one in Ukraine, and one in Bosnia and Herzegovina. Hopefully I'll have one day in the office this week, a full day in the office, and on Friday I've got a cross-government planning meeting for a Tier 1 cross-government exercise looking at preparedness for pandemic influenza. So I would say it's a very, very varied role which keeps you on your toes.